At Baker Orthotics and Prosthetics, our goal is to make a healthier individual. We have developed the Limb Restoration Program to assist those with limb difference to achieve the initiative. This video will take you through the process of the program. We provide pre-prosthetic counseling to those patients who are facing possible amputation. We provide information to the patient regarding our program and offer to schedule peer support. Once amputation has occurred, Baker O&P will provide post-operative interventions. Shrinker socks, which provide compression, may be applied to help reduce edema and shape the limb so that the prosthesis will fit better over a longer period. Rigid post-operative dressings may be used to provide protection of the surgical site and immobilize the knee. There are two options for this intervention. One is to have a cast applied to the residual limb, the other is a removable version. The surgeon will determine which is best for each case.
Going through an amputation is a traumatic experience, but I was comforted by the fact that my prosthetist was actually in the surgical room during my amputation. In fact, he was the person that put the cast on me. After a couple of days, when my leg started to swell from the surgery, he actually came back out to the hospital to recast my leg just for there being extra comfort for me while I was recovering.
Follow-up is done as the patient heals post-operatively, and a prosthetic evaluation is scheduled generally 3 to 4 weeks after amputation. At this evaluation, we have a conversation where we discuss goals, current activities, and living situations. This will help the prosthetist to better understand the patient's needs and requirements so they may formulate a prosthetic treatment plan that is tailored to suit the individual. Functional outcomes testing will begin at this point. These tests help determine the functional level of the patient with and without the use of a prosthesis. This allows us to track a patient's progress over time, showing improvements or deficits as they relate to prosthetic and physical therapy interventions, as well as physical or lifestyle changes by the patient. Changes may be made to the treatment plan based on these test scores. The patient is referred to a physician who specializes in amputee rehabilitation. The physician becomes a vital member to achieve optimal outcomes through integrated care. Once the physician visit has occurred, the patient then returns to the Baker O&P clinic for casting, measurement, and fitting of the prosthesis. This may take several visits over the course of weeks or even months, depending on the complexity of the case. Upon delivery of the prosthesis, a functional outcomes test will be performed. The patient then initiates physical therapy, which will include a thorough evaluation. The prosthetist and therapist will collaborate to provide a comprehensive and custom-tailored rehabilitation treatment plan.
The first time I meet an amputee in the clinic, I bring them in to be evaluated. So we look at what their functional ability is at the time they come in on their initial evaluation. We're looking at seeing whether or not they're able to don and doff their prosthesis, if they have any wounds, if they have any issues with just prosthetic management in general. What I want to do, now that that foot isn't really neurologically connected to the brain, I want to teach them ways that they can tune into it and specifically know that it's on the ground or not, know where it is in space, and then be able to manipulate it with a different set of musculature than they were previously using.
Prosthetic rehabilitation is a lifelong commitment from everyone involved. Follow-up appointments with the prosthetist to assess fit and function are performed to track progress via further outcomes testing. The process is cyclical in that a new evaluation may take place if there is a mechanical need or if there is a lifestyle or physical change in the patient. We hope you now have a better picture of the limb restoration program from Baker Orthotics and Prosthetics. If you would like to schedule an appointment, or if you have any questions or concerns, please call today. We have 4 locations across the DFW Metroplex to suit your needs.